Hi, welcome to Gynae Facts. It's a series of medical videos which teaches women everything they need to know about themselves. Let's talk about uterine fibroids and infertility. Uterine fibroids are non-cancerous growths of the smooth muscles of the uterus. They occur during the reproductive years of a woman and usually will begin to shrink after menopause. They usually do not cause any change or challenge in most women and are usually incidental findings during an ultrasound scan. Fibroids usually do not pose any long-term dangers to a woman. However, they could cause the following symptoms. Number 1, heavy menstrual flow. This could lead to blood loss and low blood levels in most women. In some cases, the woman needs to have a blood transfusion. Women could also have painful menses, which is also called dysmenorrhea, and this can affect the quality of life of the client by causing severe pains during their menses. As many as 4 in 10 women may have a fibroid in any given population, and by age 50 years, about 70 to 80% of women will be found to have fibroids. Several factors may increase a woman's risk of developing fibroids during her lifetime. They include genetic factors. It's well known that fibroids tend to run in some families and are common in families where a mother or the aunt is found to have fibroids. It's also commoner in blacks than their Caucasian counterparts. Fibroids are common in obese women because of the conversion of fat to estrogen. Fibroids are known to feed on estrogen for their growth. Most persons with fibroids will have no symptoms. However, when symptoms occur, many clients will complain of the presence of a shifting abdominal mass. Most women describe this as regular movements within the abdomen. Also, women could complain of heavy menses, in which case they have to use additional pads during menstruation. Abdominal pains could also occur during the menses. And in some women, they have difficulty passing urine. And this is usually due to fibroids compressing the lower parts of the urinary bladder. The location of a fibroid could determine if the fibroid could cause symptoms or not. The fibroids could be located in the intramural region, where they are found in the muscular walls of the uterus and may enlarge inward or outwards. Small intramural fibroids generally do not cause any symptoms. Fibroids could also be found in the subserosal region, where they are located on the external surface of the uterus. The fibroids could also be pedunculated, and in these cases, the fibroids will grow outside the surface of the uterus and develop a stalk with it. The fibroids could also be located in the wall of the cervix, which is the neck of the uterus. Some fibroids could be parasitic. These fibroids are usually the pedunculated ones that develop blood vessels from other structures. And then there are the submucous fibroids, which are protrusions of fibroids into the uterine cavity. Hence, they distort the cavity and increase the surface area for bleeding. They are the ones that usually cause heavy bleeds during menses. Fibroids rarely are a cause of infertility, except in rare cases where they occlude the 2 fallopian tubes. They could lead to pregnancy losses if a pregnancy implants on a submucous fibroid. Women who get pregnant with fibroids could also be at risk of pains during the second trimester of the pregnancy when the fibroids undergo degeneration. The baby could suffer from poor growth, and these women could have babies with intrauterine growth restrictions. Women who are pregnant could suffer from preterm deliveries, and they could have heavy bleeding after a delivery. There are no ways of preventing uterine fibroids, as most cases have a genetic potential. However, you may be able to reduce your risk slightly by maintaining a normal weight. Regular checkups with your gynecologist are necessary if you have been diagnosed with uterine fibroids to monitor their growth. Diagnosis of uterine fibroids usually begins with a history of abdominal swelling or heavy menses in the woman. However, in many cases, it's picked up during a routine pelvic examination or an ultrasound scan for another medical condition. Laboratory tests may be required and examinations done. The lab tests which are carried out includes a full blood count, which checks for the presence of low blood levels or anemia in the client, and of course the platelet count. This test could assist in detecting any blood disorders. A clotting profile could help to check if the woman has problems with blood clotting. A 3D ultrasound scan will help confirm the diagnosis, including the numbers of fibroids and their location, as this helps the surgeons when preparing for surgery. In some cases, an MRI or a magnetic resonance imaging may be indicated when planning for treatment or surgery for women with large fibroids to get more details about the sizes and location of the fibroids and to ascertain that they are not cancerous. When a doctor makes a diagnosis of uterine fibroid, the plan to treat will be determined by the symptoms. There are several modalities of treatment. The expectant management of treatment includes just watching the woman, and this usually requires no treatment at all. The client will usually be counseled to have several regular medical checkups and scans to note if these fibroids are increasing. Medications could also be used for the treatment of some of the symptoms of uterine fibroids or to temporarily reduce the size of the fibroids. These medications include the non-steroidal anti-inflammatory drugs such as Brustan, ibuprofen, cataflam, and these drugs are used to reduce the pains in these women. Mefenamic acid can be used to reduce the amount of bleeding during a menses. Oral contraceptive pills are used to reduce the amount of menstrual flow also. Mirena, the progesterone intrauterine contraceptive device, could be used for these women to reduce the menstrual blood flow. This is an insert implanted into the uterus of the woman. Women could also receive gonadotrophin releasing hormone agonist, and these are injections to induce a state of reversible menopause in the women, thus temporarily shrinking the fibroids and reducing blood flow to the uterus. They are used for a maximum of 6 months, and they are used to make the fibroids smaller before a planned surgery. Newer techniques include the uterine artery embolization, and this is a procedure used for women who do not desire to get pregnant. Uterine artery embolization involves inserting some gel into the uterine artery through a catheter to block the uterine artery blood flow to the uterus. The fibroids will shrink over months following this procedure. For women who desire surgery, a myomectomy can be carried out. A myomectomy involves the removal of the fibroids in women who still desire to have babies in the future. Fibroids could be removed by laparoscopic myomectomy. Of course, we've talked about laparoscopy being a preferred method for fibroid removal, and it is done by inserting a camera through a pinhole, and the instruments for surgery are inserted through the small hole into the abdomen. The fibroids are removed by morcellation, which is a procedure that cuts the fibroids into smaller bits so that they can be pulled out of the small incisions. A hysteroscopic myomectomy can be used for women with submucous fibroids, which are on the lining of the womb. And these fibroids can be removed successfully through the vaginal route without making any incision on the abdomen. Most common way of removing fibroids in our society or environment is the laparotomic route or abdominal myomectomy. And this is a traditional method. It's used for large fibroids or multiple fibroids when laparoscopic removal is not feasible. Thank you.